she's a professor, right? So she teaches nursing students. So this is probably going to be focused a lot on the nursing student, nursing school aspect of
Excellent.
your job in life, right? So I first want to know, what exactly do you teach? What year in the nursing process do you teach? Do you do any prerequisites? Where do you fit in the nursing school process here at UMass Lowell?
So our school doesn't have prerequisites. However, I teach pharmacology, which is currently to junior level students. Next year, we are moving that to the sophomore year, so starting a little earlier,
Whoa.
Getting it out of the way. And then I teach something called Community Health Project, and this is a senior level course where students treat a whole town as their patient. So they use publicly available data as well as key informant interviews and a windshield survey of the town to find health problems, and then we go address those health problems through education. So, for example, we've had students go to senior centers and do stress reduction yoga. We've had them go to elementary schools and do healthy snacks that the kids could make without an oven, without a microwave. We've gone to a home for young mothers who do not have a home of their own to talk about making their own baby food, so saving money and being healthy. So a range of topics, and the students have a lot of fun doing it.
Oh, I love that. I absolutely love that. But let's start from the beginning, right? Let's talk about pharmacology because...
Oh boy, pharmacology.
Yeah.
Everyone's favorite.
Favorite.
Everyone's not favorite.
Exactly. I know, because pharmacology is probably the most stressful class I hear the majority of students talk about.
Absolutely.
Right? So just why don't you tell me why you think pharmacology is the hardest, and then I can, because I'm not a teacher, so I'll speak to the student's perspective, but you were also a nursing student, so
exactly.
speak to pharmacology, please.
So even just coming in here, when I was interviewing for my job here, they said, what would you like to teach? And being a pediatric nurse, I said, I'd love to do pediatrics. And being a researcher, I said, how about research? And then I got here and they're like, okay, you're hired. Here's pharmacology. So I was like, great. So I think that it's hard for students. The same reasons why it's hard for me to teach is that we only have 14 weeks, one semester, to do head to toe all the drugs that they might need to know for the NCLEX. So for me, every semester, it's a new challenge to find what can I boil down, what can I cut out to just give them the essentials to be successful on their exams and pass that NCLEX. Because I know as a nurse, as you know, there's probably like 10 drugs that we really, really super know and give all the time. And the other ones, we'd have to just review or look in a drug book. So in practice, it's easier to be competent and skilled in those 10 drugs. But to get ready for the NCLEX, we have to at least, hit the big ones and, figure out where to focus most of our efforts.
That's such a good point. I love that you said that, because I think that is the challenge for nursing professors, because the 10 drugs I need working on a cardiac floor that I need to know like down pat are very different than the 10 drugs a pediatric nurse is going to need versus an L&D nurse versus a chemo nurse. So you guys as the pharmacology professors really have a difficult job to do, right? And I think that I feel like for nursing students out there, I know we have we have friction with the nursing professors, but you have to understand that they are teaching all of the nurses in the class that are going to go to 10, 15, 100 different nursing professions, and they are responsible for making sure you all are prepared for the professions you decide to choose. I want to know why you guys decided to go from junior year to sophomore year, first of all, and then what are the things that you are doing in a pharmacology class to help nursing students get a better grasp of the hundreds of meds that they need to learn in nursing school?
So I'll start with the first question, why we're moving it. So
Yes.
I can only speak to my school, which is UMass Lowell. I'm not sure where other schools have it in their placement, how they decide to place their curriculum, but our students, they really wanted an introduction to nursing sooner. So we looked at all the courses we had and said, okay, what can we move? What makes sense? And so right now, my students, when I have them in their junior year in the fall, they are taking gerontology, nursing, and psych at the same time.
Okay.
So they're getting their introduction to pharmacology and meds at the same time that they're expected to go give meds in gerontology. So we wanted to move it before the clinicals start. So that way they at least have the foundations of pharmacology and some knowledge of meds before they're handling them. So for those two reasons, student, requesting nursing a little earlier and getting them ready to go out to clinical before they actually step on the floor. So my students this semester, they stepped on the floor before they even came to my class, just the way that the week had worked out, the first week of school. And then your second question was, how do we keep it manageable?
What are you doing to help these students remember, memorize, understand, learn the hundreds of drugs that they need to? How do you go about teaching these students those drugs?
So in my class, I take a concept-based approach. So I'm not having them memorize every single, say, stimulant that's out there. We look at stimulants as a whole class. We talk about some key names that they'd have to know and recognize. Maybe like, are there some name tricks? Like for beta blockers, we know those end in LOL.
Yes.
And then we look at it as a category. So we look at the nursing considerations. What does a nurse need to know? What labs are we watching? Patient teaching. What does the patient need to know? What are some key side effects to look for? So we look at some big categories within each med class instead of like getting into the nitty gritty. So we have our first exam coming up on our chapters in a couple weeks. And on that one, students always come back to the office and say like, oh, I overstudied for it. They looked way too much into the drug chemistry, too much into the scientific mechanism of action, but just letting them know that as a nurse, there's other things we need to focus on that aren't that. So just kind of making them have their most efficient study habits through that concept-based approach.
Are you guys new? So is this concept-based approach new for you, or have you always done it since you began teaching?
I probably started this in my second year of teaching. So when I first taught the course here, when I started, I followed just what the person before me did, which was great. But then I kind of found, there's some, little tricks I can get in here and ways to make it more efficient. So for 4 years now, I've been doing this concept-based thing. But if you were to say Google concept-based education in nursing, there's whole curriculums that are concept-based. So just in the pharmacology, I'm doing it like on a small scale.
On a small scale. And is that just the plain old reason? Like, is that the why? Because you think it's more efficient?
Absolutely, yeah. I think that we have to, whether it's in school and practice, we have to increase efficiencies because we're being asked to do more and more with the same amount of resources. So